To shed light on this subject, we have live with us on the phone Dr. Amal bint Saif Al-Ma'ni, Senior Consultant Infectious Disease and Infection Control at the Ministry of Health. Dr. Amal, thank you for joining our bulletin.
Thank you. Thank you for interviewing me, and good evening for all the people who are following us.
Our pleasure. Can you please elaborate to us what is the mucormycosis? What are the symptoms and how people get infected with this?
Yeah, just to ease things on the people and not to freak them out, I don't think this is something that is really new or extraordinary. We have been seeing mucormycosis during our practice in the medical field in patients who their immune system is deficient. Whether this deficiency in the immune system has been inherited as congenital deficiency, or it has been acquired in population like the post-transplant patients or who are in immunosuppressive drugs, or the diabetic patients where the diabetes can affect their immune system. We have been always diagnosing those cases at different rates, depend on the seasonality and also the population of patients that we are dealing with. The new thing that really attracted people to this fungus as an opportunistic organism is that it has been reported in increasing number in India and linked to COVID. And the question was why we are seeing it more with COVID patients, and it's coming with the COVID cases. Otherwise, the fungus is not a new medical diagnosis, and it has a treatment, and we can manage it if it has been diagnosed early. And this is what is usually we advise: early detection of the signs of the infection and early institution of the appropriate treatment.
Okay, so the relationship with mucormycosis and COVID-19?
So the relationship, and this everybody is asking this question, it could be one of three. COVID patients who are immunosuppressed somehow are the sick patients. And this pathogen is living in our environment, and it's opportunistic. The moment it sees that our body's defense system is coming down, it would take that opportunity to cause severe disease. So we know the severe disease in COVID is more that is gone to patients who are having chronic diseases and immunosuppression. So this is one relation. The other thing, and this is what have been observed not here in India, that it's probably linked to treatment related to COVID, like the steroids. The third one is that, it's there. And because most of the patients we are seeing now in hospitals is COVID, we are seeing it in relation to COVID. So that's the three things. Do we think it's increasing? It's very hard to answer that question. Because to say that you have a surge of cases this year, you have to go to your registry in the last years and compare what you are registering this year with the previous years to see whether there is a surge, and then investigate whether COVID is related to that surge. And then see the pathogenesis, why COVID would cause that surge if it's not in a host that is usually expected to have it, like diabetes or immunosuppressed patients.
Are the patients registered in Sultanate local or came from overseas?
No. They are local patients. They are Omanis. And they have been at home. They were not in hospital. They were diagnosed with COVID, spending their home isolation, and then they came to the emergency departments. And I'm very proud with the teams there who have detected the early signs of the disease and instituted the right therapy. Because of that, the patients are improving and they are on the right treatment.
And what are the prevention measures of this disease?
So being everywhere in the environment makes the prevention really very challenging because you don't see it. It's very minute, it's microscopic organisms, and it's there around you in the environment, in the dust, in the leaves, in the plants. Usually when we know that the patient is immunosuppressed, we try to advise them to avoid activities outdoor that involve dealing with decayed plants or soil, to avoid the exposure, and to wear masks when they are doing such activities, and long clothes. That has been said, we didn't observe that this might really prevent it. So the best advice at this time to give to people that if you see any early signs that there is a development in your state, in your condition as a COVID patient, go and report yourself to the nearest emergency department.
Okay, thank you very much for your time, Dr. Amal.
Thank you, pleasure, thank you.
That was Dr. Amal bint Saif Al-Ma'ni, Senior Consultant, Infectious Disease and Infection Control at the Ministry of Health.